Okay, hi, how are you today? This is not the best lighting, I guess. It's super light. And I've got diabetes now. So they've got me type 2, I think it is. I'm just borderline. I take down on a chart every day my blood sugar. And I'm using the One Touch Ultra Mini. Uh, Looks like that. We're going to walk through on how to do your diabetes testing. First thing you want to do is wash your hands. A little bit of warm water, maybe some soap. And that'll soften up the skin. Not to mention get rid of anything dirty that might cause an infection. When you prick your finger, it's pretty unlikely. The finger prick thing is so small that it's really the tiniest cut you'll ever have. And if you've had a tetanus shot, you should be fine anyway, but just to make sure I don't get an infection to help soften up the skin for that first cut. Now this is the finger pricker part. You get these little blue things. You pull them apart, you twist and pull, and I'll set that down. This piece opens up like that. You slide your finger pricker part into there and you pull back on this side, but it'll probably lock it into place anyway. Let's turn it down to 6. I've been using 7. It's a little bit high. Now you could use most of the stuff right in the kit that comes with it, but I'll take it out for demonstration purposes. Now this is going to be the tester. It won't go on till you take your little paper strip thing with the white side up. You slide it in. Once you've got your date, you hold this for 5 seconds. You can see it lit up now. Tube C25, and it shows a little blood drop. That little blood drop means it's ready to take blood in the side of this. It'll suck it all the way through this paper strip. But you can set your date by holding this for 5 seconds, the down button, and then it'll blink to date, and it's like a normal thing to set the date. The number will blink, you set it, it'll go to the next one automatically, you set it, and that's how you set that up. And once that's all set, so now I have it set to 6. I don't know if you can see that. And I'm going to use this finger because this one's building up a tolerance. I noticed after a couple days. Hold it there. And it's not pricking enough to give me any blood. This is a problem that I'm running into. Let's pull it back. Set it up to 7. There, that one worked good. So pushing hard against it doesn't give it enough spring room. You squeeze that little bit. Try to get enough. I'm going to have to do it one more time. It's not giving out enough blood. I'm going to try another one of these. For some reason, I think because I'm pushing too hard with this, there we go, that's a good one. So you want to hold it real light against your skin. Okay, now you hold this tip to absorb the droplet of blood. And that one didn't register, so this is a real good example of what a pain in the butt this could be. Usually it's a quick 1, 2, 3 process. So let's try sliding another one of these in here. One more of these, because these things are so thin that I think they bend after they prick your finger. Rinse it off. This is pulled back. It's not even breaking the skin. There's a little bit of blood. Not enough though. Let's turn this up to... Oh, 7's as high as it goes. I've got 2 pricks there. That's a good one, okay. And then you let the tip of this, it'll start to read it. 3, 2, 1 countdown. 109. So then you go to your board. And you mark it down. You take all this stuff, which should be just one piece of plastic. Look how many it took me to get that one sample, because it wouldn't take my blood out. Everything goes back in the kit. Close this up nice and tight. These are your test strips, probably pretty expensive. And that's what it takes to take your blood. That one was a difficult one. Usually it takes one plastic finger pricker and one test strip. That test strip didn't have enough blood, so it didn't register and it shut itself off for some reason. It took 3 or 4 finger prickers, because you can see all the blood on my finger. It was just doing little tiny dots, and that's not enough. You have to have enough blood that it's going to register and prick your finger right. So I found that holding it just slightly at an angle and not too pushed down against the skin, so it's not it's got enough room to get that full swing of the finger pricker blade spring in there. And it doesn't really hurt. It kind of stings a little bit. It's kind of like, you know, you just ready for it and it's going to hurt, but it doesn't. So that's the cool part about it. I don't know about these needles. I'm trying to lose the weight. And what you'll notice is that this doesn't make sense. Is that I start out at 140 and then I have a cup of sugar or a cup of coffee, my second cup of coffee, and I go down to 109. So I take it in the morning fasting and I'm at 140, 149, and then I have a cup of coffee and I drop down to 109. I'm new at this. Maybe that makes sense to some people. Alright, I'm going to get this video out there for you all. If you have any questions, just feel free to holler. It's a one-touch mini. Thanks a lot.